We make a commitment to bosses to show up for work. We make a commitment to spouses in sickness and in health. So why is it so difficult to make a commitment to ourselves? In the new year, these three women made a promise to themselves. With the help of Truman Medical Centers, they've committed to a 10-week health and wellness makeover. A daunting challenge, but the beginning of an emergence that will transform their lives.
He is the most rambunctious, beautiful, awesome, vivacious, lovely little bundle of joy that you will ever meet in your life.
Melissa Robinson is the 32-year-old single working mother to Jeffrey. She's also CEO of the Black Healthcare Coalition and talks daily about the value of wellness. The hardest part of being unhealthy?
It is a sense of being hypocritical, that I'm sharing things with people and encouraging them to be something that I'm not 100% committed to. I want to be a champion, and I want people in my community to know that it can be done and it's not just a lot of hot air.
Melissa's motivation comes from her community, her son, and her mother, who died suddenly of a stroke at age 47.
I lost my mom when I was 18. There's probably not a week that goes by that I don't think about my mother. I don't think about some of the unhealthy choices that I'm making, and I don't think about having a same tragic ending and potentially leaving my son behind.
So I always thought that I would work forever and I'd probably be that little old lady that died on the way to the copy machine.
Brenda Mack, a 62-year-old self-proclaimed workaholic. She is head of HR for the Metro bus service in Kansas City, a job that requires Brenda to stay parked at her desk.
When I retire, I want to travel. I want to climb Dunn's River Falls again. I want to be able to do the walking, to do the climbing, and I can only do those things if I am healthy.
To be ready for retirement in 3 years, Brenda knows she's got to change.
I want to lower my blood glucose. I want to lose weight, and I want to lower my blood pressure. You know, I do still have time to correct some of the mistakes from my youth when it was not a big deal. It's a big deal now. It's a big deal.
I asked him, I said, well, would you be my knight in shining armor? And he said, sure, of course. And he goes, would you be mine? I said, yeah, but do I have to wear that? And he's like, no, but you can wear this.
At 50, Denise Bradshaw received her first wedding proposal right out of a fairy tale in front of a knight in shining armor. Denise has struggled with her weight her whole life. It's taken a long time, but she's learning how to put her health first.
This is for me. This is finally for me. I lost my mother this last summer, very suddenly. I am the only child in my family without heart problems. I need to learn and make sure that I don't have heart trouble, that I don't get diabetes, and just stay healthy.
Her family history and her fiancé, Derek, are the perfect motivation.
He has drugged me kicking and screaming down the river canoeing. He drugged me up and down a cliff out in California, out in San Diego, so I just want to be able to keep up with him. I am so trying to get ready for my wedding. My wedding is May 27th, so it's crunch times.
Of all the Truman Medical Center employees who have completed the 10-week health and wellness program, Amy Cordell deserves bragging rights. She achieved a 151% improvement in her statistics. For Melissa, Brenda, and Denise, it's success to learn from.
Just set a goal for yourself. It doesn't have to be a big goal every week, just take it in bite-sized pieces. Focus on one thing, make that change, and then move on to the next thing.
It takes goals to reach dreams.
Learning how to actually work the machines and work the equipment so that I don't hurt myself.
Count the calories, to watch the carbs.
Walk past the potato chip aisle, just keep walking, walk on by.
Dreams that a 10-week promise will inspire the emergence of a healthier new life. What can change in 90 days? A shrinking waistline to fit a wedding dress 2 sizes smaller. Newfound freedom to change old habits. Increased stamina to begin a dream retirement. In 3 months, Brenda, Melissa, and Denise have transformed their lives. With the help of Truman Medical Center's Health and Wellness Program, they're eating better, exercising more, and emerging as healthier women. Making the shift to living a healthier life is a struggle. It takes small steps and perseverance to become empowered.
The most difficult part for me has been that I haven't lost any weight. I'm supposed to be dropping a pound a week. The good news has been that the doctor told me that my body has 4 pounds less fat, and that's really good.
I just a lot of times do not know why it is so hard to put myself first. I mean, I know that I need to be here for Jeffrey, and it's so important for me to put myself first so that I can be there for him.
I think the hardest part is not focusing on that number that's on the scale, but remembering that I got into this program to get healthy and stay healthy.
Each year, Truman serves 100,000 people in our community. With Truman's help, Melissa, Brenda, and Denise are finding the strength to leave old habits behind and making better choices for the long term. It's all part of leading the way to a healthier community.
When we saw these women, the first thing we did is looked at them as an individual and talked to them about what their individual challenges were. And designing our program to customize to fit those things, that's why they were able to move forward when other people were not able to help them as much. And that's what we do well here at Truman Medical Center.
Every positive decision is a gift that makes each of them stronger.
Recently, I was in the airport and I was able to walk past the Cinnabon. I smelled it, but I didn't want it. The fact that I was able to walk past that Cinnabon place and not even want it was so huge for me. And although that I know that I still struggle, I'm finally free. But, yeah.
From the start, these women had very different health concerns. That's why Truman staff designed fitness and nutrition plans to address their chronic disease issues. And it worked.
Over the course of this program, my blood glucose has dropped 15 points. My blood pressure is normal. I've lost 8 pounds on the scales, but I've lost 19 pounds body fat. So, yay! I'm so excited.
I've lost 11 pounds of body fat, so now I know that I'm not carrying 11 pounds of fat around, making my heart work harder, making my kidneys work harder. For me, that was the big success.
Because of this program, I am no longer borderline diabetic. Yeah, that's huge.
They haven't reached their ultimate goals, at least not yet. But just like Amy, in 90 short days, they've created a new future.
Being 50 and this being my first wedding, I actually feel comfortable inside my own skin. I am really looking forward to walking down the aisle, being married, sharing my life. Hopefully we'll grow old together.
I picked Jeffrey up throughout this program and I gave him a huge kiss and I said, you know what, I'm going to be there for you and I'm going to be there for my grandchildren and I can't wait.
What I want is to make sure that I can continue doing those things that are important to me, that are fun to me, that I enjoy doing. I want to be able to continue to do them. I want to have the stamina to do them. And all that comes from being healthy now.